Hi, thanks for joining us today. My name is Christopher Guerrero. I'm a doctor of physical therapy, and today we're talking heel pain. So a hallmark sign of heel pain is us waking up in the morning, and during those first few steps, we have a really sharp pain either right on the heel or somewhere in the arch of our foot. Another hallmark sign is if you have on firm pressure of just right under the heel, that pain is going to be really intense. Sometimes people will describe this as like it feels like someone's stabbing you with a knife under your foot. So when people come into the clinic to see us here for physical therapy, we see this a lot. It's a very common condition. They'll come, they've already seen the doctor, and they come in with a diagnosis of plantar fasciitis. So if you've heard of that, or if you've had this before, it's again something very common that we see. But the term fasciitis is something, or the diagnosis of plantar fasciitis leads us to think that this is something of an inflammatory condition, which actually research as of late has started to really change our focus and start to change that diagnosis for this type of issue. So more recently, research is starting to want us to diagnose this as something as plantar fasciosis, which is really just a degeneration of that tissue, not so much as an inflammatory condition. So by us kind of changing the term or that diagnosis, it really starts to change how we treat the foot. But just to backtrack a little bit, when someone comes into our clinic and they're telling us to have this heel pain, it's really intense, they take those first few steps in the morning, the first thing we want to do is just take a look at the structure of the foot. So I'll have the person slip off their shoe and sock. I'll see how the foot looks with them in standing, and then also with them up on the table with their foot not having any weight through it. So I'll look at the foot structure. What I see oftentimes is I'm looking at the foot. I'll see a little bit of an adduction of the big toe, which is the big toe kind of moves across the foot and starts to encroach on the other toes that are lateral to it. And this is due to typically our footwear. Okay, so once I take a little bit of time kind of examining the structure of the foot, I'll take a look at the patient's shoes. So oftentimes when they come and see us, they know they're going to be doing some type of exercise and movement, so they'll come in with an athletic shoe. So I'll take a look at the shoe, and what most athletic shoes nowadays are made for is that they'll have a narrowing of the toe box. So if you take a look at the top of your shoe, and you see just this kind of narrowing coming to a point at the front of your toe. So I'll look at that, I'll bring that to the patient's attention, and then from there I'll slide out the insert of the shoe, and then I'll have them look at their imprint of their foot in that insole. And what you'll tend to see is that you'll see the foot starting to mold to the form of the shoe. And what you'll see is that big toe starts to come more across the foot. And that kind of change of position of the big toe brings up some issues that could possibly be associated with this plantar heel pain. So with the toe, due to our shoes and our footwear coming into a more of a narrow, squeezed in space, this coming across of the big toe does two things. One is the muscles underneath the foot, it puts those muscles in a long bit of stretch. And that stretch puts the muscles at a length that they're not operating well in. So what happens is the muscles start to become weak, and the muscles of the foot start to get weak, and you lose some stability within your foot. Moreover, with the toe going across the foot that way, and with those muscles being put on really a prolonged stretch, we start to lose a little bit of circulation to the bottom of the foot. So this comes as a little bit of a surprise to the patient that we're seeing, because a lot of the first day is just a conversation on footwear and structure of the foot, and a little bit of anatomy of how the foot is kind of made up. So typically, if I see that in a patient coming in on the first day, I'll suggest they make a change in their footwear. So I'll suggest they go with something that's more of a wider toe box, has less of this kind of toe narrowing, and give the chance for the foot to kind of splay naturally with the toes and help to improve some circulation. So that's day one. This is in conjunction with further assessments that we'll do, such as like seeing how they're walking, analyze their gait, test for other movement and functional tasks. But that's something that we're seeing more and more in the clinic, and research is really starting to steer us a different way as far as treatment. It's something very common. I'm sure some of you listeners are experiencing or have experienced some heel pain. If you have any further questions, come and find us. We're here at Williams Island. We have a small physical therapy clinic here, and I'd love to answer any questions on pain, footwear, helping you move better and feel better. Thanks for your time, guys. Bye.